Angelina Retorto. I am the Technical Assistance and Training Director at NISCASA. I'm very excited to be hosting this with LB Klein. I will give you some information about them in 1 second. LB Klein, MSW MPA, pronouns she, they, is a PhD candidate, an injury and violence prevention fellow, and an adjunct faculty member at the University of North Carolina at Chapel Hill School of Social Work, where their research focuses on community and policy approaches to addressing gender-based violence and promoting equity through mixed methods, community-based participatory action research. They have served as a consultant for organizations and coalitions nationally and internationally through Prevention Innovations Research Center at the University of New Hampshire, Terra Solutions, and their consulting partnership, Catalytic Consulting, LLC. LB has worked to prevent violence, advance social justice, and support survivors for over 16 years. You can follow their work on LinkedIn, ResearchGate, and Twitter. So without further ado, I'll turn it over to LB to inform you guys on this awesome webinar.
Hey everyone. It's great to see from the participants list that I know some people who are here. It's always helpful. And in spirit of full disclosure, and I was talking to my colleagues at NISCASA about this, I wrote these slides a while ago. And the world has changed and also stayed the same in so many ways, right? So a lot of our focus today is on discussion and conversation and connecting about some issues that are really important to our work to end campus sexual violence and to support survivors. And so what we'll be talking about today is addressing alcohol's role in campus sexual assault and speaking particularly to the idea that we're working with campus partners and we're working with partners both on and off campus to address the intersection of these issues. I also recognize that some of the ways that alcohol's role in sexual assault is showing up have shifted and changed, and I hope that we can continue to talk about that today. I'll share too that the toolkit is available. If you look up addressing alcohol's role in campus sexual assault, you should have a link that accompanied this webinar. If not, if you Google the title, it should be the thing that comes up, which will be helpful. There was a part 1 to this that my colleague Drew Rizzo did that focused more on the toolkit as a whole, but I'll briefly share a couple of things about the origins of this before we have folks just share who they are and where they're coming from, who are here today. And that's that there were a lot of questions circulating in a lot of the spaces that I was a part of. I started my work in campus sexual violence as a student activist and later became a university staff member and am now a researcher. And a lot of people were asking in many spaces, what should we be doing to address alcohol's role in sexual assault? There are all of these guidance documents from CDC, from Prevent Connect CalCASA, from American College Health Association, in pretty much every implication section of campus sexual assault related journal article. We should be addressing alcohol's role in campus sexual assault. But there was not a lot, and there still isn't much. We're working on more that's out there that really says, here's what you do. Here's what you can do to actually address this intersection. And so part of the work that we did alongside an organization called Campus Advocacy and Prevention Professionals Association, which is a national organization, has over 900 members across the US, Canada, and beyond, who specifically do survivor advocacy and prevention education work on or alongside college and university campuses. I know that several folks, at least who are a part of this webinar today, are members of that organization. If you're interested, it's free to join, nationalcappa.org. So I worked alongside CAPA with an expert advisory board and with 23 participants who are prevention educators on college and university campuses in the US to develop this toolkit. We also have a journal article in the Journal of American College Health, if you're interested, that shares some of our findings and more of an academic capacity. And we're currently working on another journal article with several of my colleagues, including Taylor Stolting, who's based in New York State, that explores the LGBTQ specific findings that emerged in this research study, which I'm always happy to speak to as well as we move on, but those are still in process on getting out there into the universe. So in developing this toolkit, we really looked to prevention educators for what would be useful to them. How do we apply this information? How do we think critically about addressing this intersection in the absence of, here's an intervention that's been developed over 10 years, or here's a prescription. What are some questions to ask? What are some considerations? And that work was informed both by research, an extensive review of both peer-reviewed publications and also reports, et cetera, that are out there, as well as those conversations with 23 prevention educators and a process alongside another group of expert advisory board members. So this work is still unfolding, but much of it is encapsulated in this toolkit. So I'll share a little bit about where we're headed today. So in the first webinar that we did that major overview. I know there's also been some work that happened before today related to some of the social justice related implications of the toolkit. That's inherently a part of both the toolkit and what we're talking about today, but I know that that section of the toolkit was covered elsewhere also. But I'm hoping that we can look through 3 major topics that are covered in the toolkit, and I'm hoping that we can have some conversation around it. I recognize too that bandwidth lately is challenging. There's a lot that's happening that's incredibly relevant to the work that we do to end gender-based violence, that we can't end gender-based violence without addressing racism. We can't end gender-based violence without thinking about the new situations that we're in that are posed by physical distancing, by the incredible health disparities that we're seeing for various communities, especially Black and Brown communities, around COVID and around a variety of issues. And I'm hoping that we can have some conversations. I also recognize that it might be hard to do that. So I will continue to pose questions and we'll see where all of us are at, but I welcome your participation, but pass to participate to a level that you feel comfortable today. And always, but maybe particularly today. So I'm hoping that we can go through a few things. We'll do some introductions. We'll talk a bit about social norms, which is part of the toolkit, trauma-informed messaging, which may be particularly relevant as we're planning and thinking about the fall on colleges and university campuses. We'll go through some difficult questions and kind of unpacking how we could answer some questions that are particularly challenging. And then we will go through some ideas for further next steps that might come up for all of us. What's next with the work that we're doing on this topic, and anything else that works for you all. My colleagues at NISCASA will also share some more New York specific information about addressing alcohol's role in campus sexual assault, which may be valuable to you. So you should be able to see, as I know some folks have used it, that there's a chat with today's webinar, and that chat probably is defaulted to all panelists. If you want to share with everyone, you can select the drop-down menu and move that over to all panelists and attendees, whatever works for you. But if you want to engage other folks, it's helpful to have that all panelists and attendees selected. I know every time I participate in a Zoom webinar, which is more than I ever thought I would in my entire life lately, that I sometimes forget, so I just wanted to share that. So I'm hoping that we can do some introductions and just share a little bit about who we are and who's present in our virtual room together. And in the chat, if you could share who you are and your role in organization and what you're hoping to get out of today's webinar, I would love to know that and make sure that I can tailor what we're talking about to you. If you're willing to share that in the chat. I want to share as well, as folks are doing that, just a couple of notes about how this toolkit came to exist around partnership and funding. So this project was funded by a Prevention Innovations Research Center Innovative Research Award. They're an organization based out of the University of New Hampshire, with which I have a fellowship. And this toolkit was developed really between our research team, Kappa, and Prevention Innovations. And that partnership has been really rewarding for us because folks have had the opportunity to come together who are researchers and practitioners. And I think the way forward when it comes to addressing any issue is really ensuring that folks are partnering and are able to really work together. So the theme of today's webinar really focuses on those partnerships on and off campus, on addressing alcohol's role in campus sexual assault. But we tried to model that as much as possible in the process of creating this toolkit and our publications that are associated with them. So it's great to hear from folks in the chat. And I grew up in Stony Brook and Brentwood on Long Island. So my heart is always in New York, but especially over the past several months for sure. And I'm based in Chapel Hill, North Carolina. Fantastic. So I'm hearing from folks who are advocates and education specialists. Someone's in Ithaca, Rochester. Hey, Taylor. Who's at King Ridge Heights Community Center in the Bronx. Folks in Jamestown, Delaware County, and Rick is in Brooklyn. Cool. Awesome. It's great to hear from all of you. And a lot of folks I know who are here are working alongside campuses but aren't based on campuses. A big part of the creation of our toolkit as well was talking to folks who were based on campuses and reviewing all of the materials that we had and seeking additional support from folks who are working alongside but not for institutions of higher education. And I know that now is an interesting time to be engaging in those partnerships in various sectors, including in New York. Bethpage, Stephanie's in Bethpage, cool. Working in victim intervention. Very cool. Someone's interested in, Lara's interested in looking for the trauma-informed element. Great, I will make sure to stress that. And Chelsea, thank you, Chelsea, is interested in ways we can support advocates and programs with these collaborations and partnerships. Very cool. Awesome. Aaron is in Albany County. Oh, great. And Rick's talking about safer bars. Very cool. All right, so thank you to everyone for checking in. I will move right along for some discussion on social norms. Okay. So social norms. So a big portion of the work that we were looking at with our toolkit was around with folks kept bringing up social norms and social norm change. And there are a lot of different dimensions to social norm and social norm change. What we found in our toolkit from the research and from what prevention educators were sharing with us is that folks were often seeing that what students believed on campus was really different than what they had from their data. Luckily, and we can get into more of a discussion of this too, but luckily we have more data now. I think back to when I first started doing work on campus sexual violence, and I had to spend an inordinate amount of time, a lot of time, explaining to folks the difference between prevalence and reporting, for example. So folks would say, oh, our campus has 2 sexual assaults, or our campus has had 0 sexual assaults for the past 10 years. So this isn't a problem here. And we have some better data now around prevalence, including at times prevalence related to sexual assault that occurs within a context where alcohol is involved, where the person who's harmed has been drinking, the person who's caused the harm has been drinking, or where there is an alcohol-fueled environment. And having that data and information for the campuses that you're working with can be really valuable information to have. It is best practice for campuses, if they conduct climate surveys, to share that climate survey data publicly. If you can't find it publicly, I think it's perfectly great to ask for that data, and that data really should be provided to folks so that they can make decisions about how to do prevention work. There are campuses that all campuses don't look the same, right? We have a variety of campuses and we have a variety of student experiences, and social norms also vary between groups on campuses. And so if it's possible to have information about how social norms vary between groups, it's always incredibly helpful to have that. A big portion too of the conversations that we had with prevention educators about social norms campaigns is that they often were releasing social norms campaigns into the community, but it was really hard to, one, get traction to put up information in locations that were useful to people, and two, to ensure that those campaigns met the needs of the students that they were working with. That often social norms campaigns were brought in externally, that were prefabricated, but also had not been reviewed by folks who were on the campus community. And one thing that a lot of the prevention educators in our study advocate for, and then I know I advocate for, is to ensure that any programming that goes out on a campus in our community involves the voices of the folks who are in that community. That even really small changes to something can take someone out of understanding its applicability to them. So, for example, if somebody is looking at a social norms campaign and very clearly the side on which the messages appear in iMessage on an iPhone are not the ones that show up in person, that can be a big issue, as my colleagues at Prevention Innovations have found in their work around social self-identification. We also know, though, that sometimes folks release social norms campaigns and don't get the culture of a campus. A really good example of that around high-risk drinking is that many campuses have released campaigns about alcohol use and misuse that talk about, well, only this number of students engage in high-risk drinking, like only this X out of X number of students drink more than 5 drinks on the weekend. And what's unfortunate is that sometimes on campuses that have a particular value around excelling and being exceptional, that can then lead people to drink more, because they're like, oh, okay, well, I want to be exceptional. I'm reading these posters, and I'm going to have the posters up for the drinking games, and we can all seek to be the exceptional student on our campus. And so whatever we do and whatever messaging we share, it's really valuable to share information out of there. So DJ is sharing us with the New York Campus Climate Survey results must be made public. That's wonderful. I've talked to some, I do a lot of work with colleges and universities across the country, and in states where that isn't required, sometimes I get a lot of pushback, especially on statistics too that dovetail with alcohol use and misuse. But there's a lack of transparency in a lot of places around the country. What I think is useful too around sharing data is also how it's shared. So something that's really common, and I say this as someone who a lot of my life involves reading really long documents and looking at data and looking at really long reports, is that it can be helpful not only to share data, but share it in ways that are useful to folks. So for example, a lot of what I see from campuses sharing information about sexual assault are the annual security report, the ASR for Clery, which is usually a 50+ page kind of dense PDF, or sharing information via a report. So if I think about ARC3 data results, American Association of Universities results, various climate survey results, the results are often really useful to folks who are making decisions, but are not necessarily as useful to the public because they're not designed as much for the public. And Taylor, I appreciate your want for this, because we're going to be talking about that in a little bit later in the webinar, that a lot of times, as Taylor is mentioning, a lot of the work around alcohol's role in campus sexual assault focuses on campuses that are residential and focuses on campus that have fraternities and sororities. And so some of this conversation is going to be about what it looks like to do this work, which is really important, on campuses where that's not the norm. Within the context that a lot of things are shifting around space and gatherings. And so there's a lot, I think, that we'll be thinking about on a variety of campuses that might have had a more traditional trope around the college, what quote unquote college experience, right? So if we're thinking about target audiences, it's really helpful to brainstorm and think through who are the folks that I'm trying to reach with this. And a lot of times what unfortunately can happen with messaging is that we can say, okay, I'm going to release general messaging and then I'm going to do tailored messaging. And often what the general messaging appeals to is the quote unquote average student. I'm not sure what that means or who that is, but how it often translates to is students who have the most social privilege and have the most kind of clout on their campuses. That often translates to students, particularly at predominantly white institutions, who are white students, are traditionally aged students, are residential students, et cetera. So it's important for folks to see themselves in materials that are developed for campus. So for example, in a lot of the work that addresses alcohol's role in sexual assault, there's a huge focus on students who are engaging in high-risk drinking behavior. It is important to address high-risk drinking behavior in the context of sexual assault or otherwise. But it's also, if we're only addressing high-risk drinking, or we're making the assumption that everybody is engaging in high-risk drinking, we're really shifting some of the social norms around the actual experiences of drinking on campus, which is some people don't drink at all, some people drink a lot, some people use drinking as an excuse to harm people, some folks drink a moderate amount, some folks drink occasionally. And so providing that nuance is really valuable. So a question then becomes around this intersection of alcohol's role and campus sexual violence is, what data or information will you use? And I'm wondering what information is useful to you or has been useful to you in your work as you think about sharing information and shifting social norms in the communities and on the campuses with which you work. What kind of data or information is helpful or would be helpful to you in doing that work? I'm going to drink some of my tea. But what information would be valuable? It could be information you have, it could be information you wish you had. I know that for a lot of the folks who participated in our study, information that was really valuable to them came from campus climate surveys, but also came from some other surveys that are delivered on campuses. The National College Health Assessment was one example of information that was useful, that they could access information on both drinking habits, drug use habits, and sexual assault victimization. There are a lot of campuses now that are also using online modules, and I imagine more campuses will be using online modules in the future related to some of these issues of reaching all students. And so I know it's been useful for folks too is to get a good snapshot of incoming students, and particularly if they can stratify that information by students who live on campus and students who don't, by certain demographic information, et cetera, has been really helpful for them. Another piece of data that I know has been really valuable to people has been data that relates to the community that surrounds their institution. So I think some campuses can really focus on only their campus data, but especially for institutions that are highly embedded in communities, and where being on or off campus is as simple, is not a really as simple thing. It can be helpful to really dovetail information from the community with campus information and see what differences do or don't exist. So Lara is sharing, most of the data I'd like is local. I'm in a college town and want to know more about which bars students are going to, which are allowing for more underage drinking, what the reputation of bars are for students, and more qualitative. Yeah, so that data too is like, there's a bunch of stuff that isn't written down. So part of why I did this study, and part of why I do a lot of studies that involve talking to practitioners or talking to students, is that there's all sorts of wisdom that isn't written down, right? So like there are students who know, here's where you go where no one is going to guard you, right? Or here's where you go and no one really pays attention to your wristbands, or the wristbands are really easy to remove if you are underage drinking. Here's information about where folks congregate and gather to party and socialize. I know on campuses that I've been a part of, in working closely with students. So for example, I worked with a campus, and the perception of a lot of the staff on that campus was partying was athletics and fraternities, which was, there was quite a bit of partying that was happening in those spaces, particularly in off-campus housing for athletes and for Greek organizations, particularly fraternities. But once we dug in a lot deeper, there were many other social spaces that were happening on campuses, and in particularly on that campus, there were student organizations that weren't getting any attention related to the cultures that they were perpetuating around bystander intervention, et cetera, because they weren't considered those more high-risk organizations. And that was really an important thing for us to learn. So gathering that information, talking to people, learning that information is really valuable, and figuring out what those partnerships look like, as Lara mentions, around the reputation of locations. I know some of the work that our participants highlighted was also that you can do really great work as a staff partner, as a community partner with organizations, but sometimes it's organizing, right, that does the difference. And so I've talked to several folks on campuses where what shifted bar cultures in the neighboring areas of their institution toward bystander intervention, toward paying attention to harassment folks were experiencing in those spaces, et cetera, did certainly involve training, and some folks have mentioned safer bars and safe bar programs. But the impetus for that was students saying, if you don't go through this training, like, we're not going to go. If you don't, if saying to organizations, campuses saying to organizations, if you don't follow these policies, people aren't going to feel safe going to your social events. And so we really need you to buy into this. And that social pressure was able to create some change. Because the students, and as Rick is mentioning, in major cities, a lot of the student life happens off campus and not on campus. That those students have a huge influence on the surrounding community and can advocate for some change, for sure. I think the other piece on the on-campus, off-campus distinction is that while sometimes university administrators feel that they have greater influence on campus, they often kind of move things off campus, like, oh, that's off campus, I'm not going to worry about it. And what we know, and what is critically important, is that students on campuses are not just like off campus and on campus people. They're not like different people on and off campus. And I think that our recent experiences of physical distancing have really shown us that, right? That students are whole people, and it's important when we're partnered with folks for them not to say, oh, well, that's an off-campus problem, because students are not magically different on or off campus. Rick would also be interested in seeing how many reports are made by students outside of campuses versus those that report to campuses. Absolutely. And I think that it's hard right now to get really good community prevalence data. It's hard to compare on and off campus. There's some great studies that do so, but kind of on the ground, granular level is challenging. But it's helpful, I think, to see too, when folks are getting help, where they're going. And I'm hopeful more and more that campus climate surveys can be better at capturing this. But there's a big difference between somebody getting support from the particular institution and choosing to not. And that has implications both for folks who are work on the campus and off the campus, where information is shared, who's seeing it, who is getting that support, et cetera, is really important. Monica shares we work with at a hospital that works with med students and other grad students. It's hard to find data, resources, and models that apply to this non-campus population. Absolutely. So I've done work with a few campuses that are specifically medical campuses. And as Monica is saying, the information that's out there is limited. If you email me, Monica, I can share with you what I know from trying to dig for it. But there's a real lack of information. I'll address both of the parts of this Monica's sharing. One is it's hard to get information about healthcare systems, including universities, to clarify like who they think people who work in hospitals are. So if folks are trainees, if folks are residents, like technically folks are staff, but they're in training. And so there's all sorts of implications for those roles. And often folks aren't clear on what those roles are. There's a lot of power dynamics. And the others are on graduate students. So I work with a few different data sets. One that I work with a lot is the American Association of Universities data. And what we see in that data, what many of the participants in the study see, is that the topic of graduate students just doesn't seem to come up for folks when they're talking about campus sexual violence, which is a huge issue for multiple reasons. The idea that the issue, I think that folks think often that the idea around campus sexual assault and alcohol's role in it is all about underage drinking and targeting new undergraduate students. And that certainly is an issue, right? Folks are acclimating to a new environment. Folks who are intending to harm other people target those students who are new and are not, don't have as much awareness of the norms on campus, or trying to fit in, or trying to figure out and navigate a new culture. But graduate students are in a very similar boat. Graduate students are in situations where there's a lot of power dynamic, and where we can do some work on campuses that are, you know, above a certain size to move around undergraduates. If you're talking about, say, PhD students, medical students, students in healthcare, if you're trying to specialize in pediatric cancers, or if you're studying Renaissance literature, your pool of people is a very small pool of people, right? It's hard to move around and navigate being in different spaces. So I'm a doctoral candidate here in North Carolina, for example, and in my cohort of doctoral students, there are 5 of us, and there are 2 people who are in my department who really study what I study. And so if those relationships are strained because someone has harmed someone else, if there are environments that happen through parties, conferences, networking events, etc., where folks are harmed, those spaces becoming unsafe have incredibly huge career implications, and being able to share information looks really different in those spaces than it does with undergraduate students. So if we're just giving people parties and drinking, it doesn't work for a lot of traditionally aged college students who are residential and are on campuses with a huge residential culture, but it certainly doesn't work for our commuter students, students who are not traditionally college age, students who are more embedded in the communities around them. And we need to do better to think about those environments. Another example that I think about a lot in getting data or information that I'm working on a lot right now is getting information about what other folks are doing to adapt as situations change on campuses, and also how situations are evolving for folks around alcohol's role in sexual assault with added physical distancing measures. And certainly in New York, there's been a more robust response related to COVID than in some other parts of the country, where folks are navigating a lot of situations where there's less kind of statewide continuity and partnership. But I think about with alcohol's role in campus sexual assault, that folks are still dealing with the intersections of sexual assault and alcohol, even if they're not physically going to campus at all, right? And many of us work with not only commuter schools, but schools where students are online, and we're seeing rise in substance use and misuse. We're seeing a rise particularly in violence that is occurring in the home, that just because folks are at home and staying home might be valuable. When it comes to COVID, staying home might not be safe at all for folks related to violence and abuse. And so I think it's also helpful to kind of gauge and learn from the universities that you're working with. What are they seeing from folks? And if they're not seeing things, what does it look like on a regional level? What does it look like on a statewide level, to connect with each other and see what other folks are seeing? Because we know that this is evolving, and we know that abuse tactics as well adapt to circumstances. So if we're talking about folks being in safe or unsafe situations, coronavirus and COVID-19 are a dynamic of that, right? If we're talking about folks being more physically distanced, more isolated physically, that is going to impact campus sexual assault. It's going to impact alcohol use. It's going to impact the intersections. If folks are not gathering in more public places, but are gathering in more private places and are gathering in smaller groups, that's going to impact the dynamics of campus sexual assault and of alcohol abuse and misuse. If folks are spending a lot more time with their socialization being outside as opposed to inside, what that means for the dynamics of sexual violence in spaces that are often kind of public-private spaces, apartments, et cetera, people are partying. If folks are instead partying in outdoor venues, those dynamics shift. And we're learning how, right? This is how we're responding, as we always do, as folks who do prevention education, as folks who do advocacy. We are always responding in real time, but particularly with such drastic shifts of recent, we are continuing to respond in real time. So I wanted to give an example, and I wonder what other folks might think here about social norms and lesbian, gay, bisexual, transgender, queer, and other sexual and gender minority students. So a lot of times what I hear, and I'm wondering what your thoughts are too, is we need to tailor and adapt programming to meet the needs of particular groups, which is a sentiment I agree with. And there's two challenges, I think, to that. One, sometimes what that can start to look like is we're adapting our programming, and we have this sort of like, I guess we're calling it neutral programming for everyone. And when that programming isn't neutral, and we in fact need to adapt our universal prevention strategies in such a way that they're meeting the true needs universally, right? We can't perpetuate heteronormative or cisnormative prevention messaging in our general programming, that our universal programming that's not targeted toward a specific group, and then say, okay, we have this programming, but then we're going to do targeted programming for LGBTQ people, right? And we should do programming that specifically makes sense to a given community, but we need to also ensure our universal work is not perpetuating harm, particularly because if I'm thinking about the needs of LGBTQ plus students around alcohol's role in campus sexual assault, that it's a group of students, like many minoritized groups of students, who are in fact used to experiencing more intervention than other groups, right? We're talking about bystander intervention, intervening, if you notice something, do something. Queer and trans people are used to being noticed more often than students who are not queer or trans, right? So what can be really important is to be thinking critically in all of our prevention messaging. What does this look like for various groups of students when we're doing universal prevention, prevention that is, PSAs, social marketing, online trainings for large groups of people? How do we ensure that is not perpetuating harm and also is helping to advance positive social norms? The other thing that can sometimes happen, that emerged a lot in our findings to the point that we're writing another paper on it, is that we can often seek to tailor programming to groups without really getting a good handle on what's happening in those groups. So as an example with queer and trans students, a lot of folks who we interviewed, prevention educators, said we really need to be addressing the needs of LGBTQ students. A lot of our sexual violence prevention materials are very hetero and cisnormative, emphasis on the cisnormative, even more so than heteronormative. And particularly substance abuse materials are often very binary, very male bodies. You can't see me, I'm like, the finger quotes are huge right now. Male bodies, female bodies, here's the number of drinks, here's this or that. So they're trying to figure out what to do within these very cis and heteronormative spaces. And the problem is we end up just trying to figure out how to overcome those challenges, right? These materials are problematic and harmful. What do we do to make them, not hurt people? And we can miss out on some really important information and findings. And one of those findings now from multiple studies is that LGBTQ plus students actually, compared to their cisgender heterosexual peers, know more about getting consent, know more about bystander intervention, know more about a lot of these sexual violence prevention concepts we're teaching than their peers. And so it isn't a matter of simply LGBT people don't know, they haven't had this education, they actually know more, right? And so we need to think about not only how are we being supportive of LGBTQ students, but what are we missing out on that folks, as we can also see in the data, right, don't feel they're getting the support that they need, don't feel comfortable intervening, right? What are the dynamics there? So we can't just simply say we need to provide education. If we provide education and then folks say, okay, the result of that education is I'm supposed to call for help and I feel that my partner or my friends are going to be treated unfairly, it's a different dimension to address, right? If you're feeling as though, okay, you know, people know this information, but what are they going to be able to do with the information, depending on the context that they're a part of. They know this information, but they don't see it as applying to them or their friends, people that they're with, because it's delivered in such a way that we're making assumptions about people's bodies, about people's relationships. And so what can be really valuable in thinking about social norming is we inherently need to, of course, specifically address issues of groups that tend to be targeted for harm. We know that especially trans and non-binary folks, and especially bisexual women, but all LGBTQ folks experience sexual and intimate partner violence at the same levels or higher than their heterosexual and cisgender peers. And transgender and non-binary people in particular are targeted for violence. We need to think about that, and we need to deliver messaging accordingly, but we also need to think about they're existing in a culture where everyone else who is not LGBTQ+ needs education, information, etc., and has things to learn from those groups, because we're seeing over and over again that minoritized groups, including LGBTQ folks, have a different level of knowledge, but don't feel that level of support. And who can change that level of support? Who can change that folks are feeling that they're being taken seriously, that folks around them support them? That's the folks who aren't a part of the group that is being targeted. So we need to balance both of those things as we consider both universal and selective or indicated prevention. Watching my time. So I'm open to what other people have to share, but I know that a lot of what we're finding out in this, in reviewing our findings from this project related to LGBTQ students and the folks who work with them, is there's a lot of, here's our programming and then we're adapting, here's our programming and then we're adapting, or I don't know how to adapt it, or I don't know how to make this work. And some folks have mentioned around the data that they want, some of the data that they want is around story and experience. And that also involves, trust, that involves establishing rapport, that involves digging deeper with folks about what is valuable to them, about what they know, about the information they have. And so for us, triangulating information that's from literature, that's from the interviews that we've done, and from folks' lived experience is really valuable. What we know too, when it comes to social norms, is that folks need to see themselves in anything that is coming out there and in any of the materials that are there. So I know that for me, and this may or may not bear, forgive me for a moment, I've done a lot of work in New York State, and New York State, of course, has a lot of different, and you've already mentioned that and what you're sharing, different parts of it. I know for me working in North Carolina, that living in the Research Triangle area, there's a lot of work around LGBTQ issues, and there's also a lot of stigma, and there's also a lot of challenges in putting out LGBTQ information or sharing images of queer and trans people that are overtly queer and trans, right? And so for some folks in the areas you work in, it's like it's kind of a non-starter, but for some folks that might be a big issue. And I know that for the campuses that I've worked in who've really successfully worked with their queer and trans students, they had to not only be visible in a way that involved, safe zone training and rainbow stickers and the rest of it, but also to be really clear throughout their work that they weren't just tokenizing LGBTQ people, but they were really embedding queer and trans people in their images, in what they were talking about, and that they discussed dynamics specifically related to being LGBTQ. So for example, campuses that were less successful with this partnership made a lot of things gender neutral. I'm not sure where gender is neutral. It's not gender neutral where in the box that I live in here online with you all, but a recommendation that pops up a lot is let's just make every scenario with folks who are named Alex, and we don't know the gender of Alex, and so it's inclusive of everyone. And what we know also from research is that when you give people who are thinking in a heteronormative and cisnormative way, scenarios with gender neutral, giant finger quotes, names, they still read them as heterosexual cisgender people. And so we need to be explicit about what folks are going through. We need to be clear, not explicit, not sexually explicit, but explicit about what people are going through and the dynamics that exist in part because of identities. In addition to just saying, okay, we've neutralized the people in the scenarios. And so a lot of the work our prevention educators did was about those dynamics, that it looks different to report something or seek counseling in LGBTQ spaces. Or some ways it's similar, some ways it's different. So getting a real sense of those dynamics and learning from students who are a part of those campuses was really valuable to those folks, as opposed to kind of gender neutralizing everything. I'll share just one other example and some work that might be valuable to you. There's a recent study published in Journal of Family Violence from Carla Chugani and her colleagues that talks specifically about students with disabilities and alcohol's role, alcohol and sexual assault prevention education, that folks often felt really left out of those conversations. There's a lot of language that popped up in talking to our participants that was also ableist language. There was a lot of kind of stepping up, stepping back. There's a lot of words around bystander intervention that can be really ableist. And that folks often, especially in our current online reality, were not able to access information because there were not closed captions. They weren't able to screen read what was shared. So folks were putting out a lot of Instagram information or Twitter, and not Twitter information, but graphics through Twitter, et cetera, that they couldn't read them, that folks were sharing, were providing workshops, et cetera, that were not accessible to folks. And so social norms are also really important to think about, because students, if they can't even access the information designed to shift social norms, inherently feel removed from that, even if those students are an incredibly high risk for violence. And we know that students with disabilities are at a high risk of violence. There's a report called Not on Our Radar that provides a lot of information about this group of students nationally, but on campuses in particular, getting that information can be really valuable. I know that a lot of places, if you look at information for students with disabilities, it's also really helpful to get a sense of how they're defining disability before you use data to make data-driven decisions around particularly targeting your messaging towards students with disabilities. So for example, some studies and some data collection uses if the student has a disability registered with the university. And there are certainly students who have disabilities that are registered with the university, right, who are seeking accommodations of various kinds, including time and a half, et cetera. And there are plenty of students who have disabilities that are not registered with the university. And so what's helpful is seeing that information kind of broken down by disability type, to know what disability is defined as, because if we're just looking at a list of students with registered disabilities on campuses, that can be somewhere between about 3 and 7%. Students who are on campuses who are living with disabilities, who are registered or not with the institution, can be closer to between 19 and 27% of students. And so it's important to really know what the data is, where it's coming from, all that kind of stuff. Because there is also this inherent kind of marginalization that happens in data about students with disabilities that can be helpful to investigate. So I will move toward introducing this next piece here. Let me watch my time. And if folks have questions, feel free to share them at any point throughout, and I will look back and forth you see them. So getting into trauma-informed messaging, and it's hard to talk about social norms without talking about messaging. But a part of our toolkit also involved really thinking critically about what is trauma-informed messaging around alcohol's role in sexual assault. And I'm just going to go to our page on that to make sure I'm looking at it while I'm talking to you. I don't miss something. A lot of times, a key issue that emerged for us and emerged for me as someone who was the principal investigator on this project was, okay, we're going to address alcohol's role in sexual assault. I started the work that I do as a survivor advocate, working on hotlines, working with student survivors, working with survivors in communities for domestic and sexual violence, responding to hospitals, et cetera. And as someone who does a lot of prevention education work now, thinking about doing anything on addressing alcohol's role in campus sexual assault, I had a lot of fear about wanting to make sure that that was done in a way that was so explicitly trauma informed, because so much messaging about alcohol's role in sexual assault is incredibly victim blaming. And even folks who are really not trying to do it, it's just really easy. We have so much cultural stuff around alcohol and using alcohol to blame people for surviving violence that it's just really easy to creep in there. So in our toolkit on page 17, we have a list of things not to do in messaging about alcohol's role in campus sexual assault. And they're all crossed out because a lot of what the prevention educators we talked to told us was that they keep going to workshops at conferences, or they keep going to webinars or other conversations where the focus is on what not to say. And we need to talk about what not to say. I still see campus materials over and over and over again that talk about sexual assault as a consequence of drinking. There are consequences of drinking. Hangovers often occur, as an example. But sexual assault is not a consequence of drinking. It's not a real thing. So their messages are still problematic and out there, but we wanted to move into what could folks actually say. And on page 18 and 19 of our toolkit, we provide some guidance on what those messages could say in a way that was trauma informed. That on the flip side, we also don't want to completely remove any discussion of alcohol, which some of our prevention educators we talked to, that's what they opted to do. And students would say to them, like, but how does this relate to being at a party? What if I'm drunk? What if I'm intervening as a bystander, but like I've had 7 drinks and I'm feeling sloppy? Like, what does that look like for me? And so the guidance that we developed, I think has been helpful to people and has benefited from the wisdom of a lot of prevention educators who've thought about this for a long time. Involves a few different areas that we worked on. One of those was about thinking about the effects of alcohol consumption and talking about them. So we can't teach bystander intervention at a party and assume everybody who's doing the intervention hasn't had any drinks. I mean, people are people at the party who haven't had drinks, but it might not be every person. So it's important to talk about those dynamics. We talked a lot about connecting alcohol to other issues. For example, addressing the role of bystanders and discussing how alcohol plays into stereotypical ideas about gender roles, sex and dating, and challenging them. So if we talk about alcohol and all the problematic ways that it's used to excuse behavior, all the things that are normalized related to alcohol, who gets to drink irresponsibly and who doesn't, and how that plays into race and class and gender and sexual orientation and disability on our campuses, we need to talk about that. And if we can talk about alcohol in that way, it's important. If we don't talk about alcohol in that way and we talk about it in this like, you know, medical and biological way, we end up in these conversations about incapacitation and how many drinks and all that kind of stuff, which is not necessarily very useful when you're actually talking to folks who are navigating their social life and sexual interactions, right? Because folks are typically not breathalyzing people, counting their drinks, knowing what other medications folks are taking, et cetera. And also, we talked a lot about the importance of thinking through alcohol in folks who cause harm and shifting our messaging there in ways that, for example, examined biases related to the behaviors of people who use alcohol to commit sexual assault. What does that dynamic look like? How easy is it for someone to camouflage into an environment on your campus or in your community where they're using alcohol to target people? Discussing ways in which alcohol is used as a tool to gain power and control, how alcohol, like many other things, can be leveraged, people who intend to cause harm. And then sharing data on the presence of alcohol in cases of campus sexual assault. So having data transparency from cases on campus, both reported through prevalence data and cases that have been adjudicated on campus or in the community about alcohol, can be helpful so folks can see how alcohol was used if it's possible to share information. And so trauma-informed messaging, what came out for a lot of our participants is that every time we're talking about alcohol's role in campus sexual assault, we need to be thinking about people who've experienced harm while they were drinking, people who've experienced harm while the person who harmed them was drinking, people who've experienced harm in environments where there is alcohol, people who have, subsequent to experiencing harm, have started to use more alcohol, right? We need to think about those folks anytime we share a message, that just because we're sharing a prevention message doesn't mean we shouldn't be thinking about folks who have been harmed. And in fact, our prevention messaging is harmful if we're not doing that, because if we're norming people to talk about alcohol in a way that blames people who were harmed while they were using alcohol, we're making it, not only making it worse for them, we're not helping prevent future assault. We're not helping prevent and shift environments. So I'm hoping to talk a little bit about tailoring messages, and the topic that I'm wondering if we can talk about, if folks are willing and are thinking about this, is around tailoring messages related to calling for help. And I have a few examples of this, but based on what folks have shared previously, I'm going to focus on two of them, which are graduate students and commuter students. And based on the conversations we've had so far today and what folks have shared and what I've shared, I'm wondering if folks have thoughts on how they might think about tailoring messages about calling for help for either graduate students or commuter students. So this could be messaging around, hey, we have medical amnesty policies, or this could be messaging around, if you've experienced violence, if you're experiencing violence, here are resources that you can call. This may be around calling for help or support if someone has witnessed someone else experiencing violence. How would you tailor those messages to meet the needs of graduate students or commuter students? And as folks think about that, right, there isn't one graduate student or one commuter student, so it might be helpful too if you're thinking, well, I don't know, like, there are questions I have first. Let us know what those questions are that are coming up for you around how we think about these messages around calling for help for commuter students or graduate students. And while folks are thinking about that, I can share a story that came up as part of our interviews about graduate students. So grad students were receiving a lot of messages at this particular campus, which had medical students, law students, students who were pre-nursing and in nursing, master's and PhD programs, pharmacy students, social workers, etc. Those graduate students, the only message that they were receiving around calling for help was around either going to campus counseling or calling the police. It's the only message they received. So it was, here's the number for police, on campus, off campus. Here's the number for campus counseling. There wasn't a lot of other information given. And what happened for those students is that they were like, well, I don't know if I need counseling. I don't know if I need therapy. Like, I don't even know if these resources are like freely available or I can access them. But they also were like, well, police is like a really high bar for me to access right now, or I don't feel comfortable talking to the police. Like, well, how's it going to affect my career? How is it going to affect other people who I know? If police show up, are they going to cause more harm? Are they going to harm people I care about? And so a lot of the work that that colleague did with graduate students was getting a sense from them, like, what would help look like for you? And what would resources look like for you? And they actually ended up working really closely with the graduate student affairs folks in the campus, the folks who provided information about, who advised student organizations, who helped with advising. And those advisors became the best possible route of information and helped to disseminate that information in ways that grad students really felt good about it and could tell other people about. And so instead, and we also got feedback from those graduate students that they might be interested in off-campus or community resources, but they weren't just going to call a hotline or show up somewhere. They wanted something specific to their school, but they didn't want to have to go through some specific next steps. So those student affairs advisors became a really helpful touch point. And then within each of those schools, the messaging that emerged was specific to each of their career preparations. So they were kind of like backdoor training them as future doctors, nurses, social workers, et cetera, while also providing specific information to them. And the training that they did was a part of the students' professionalism classes that trained them in kind of the how-to of their professional lives. And that particular information was really valuable. So as one example, in the business school, a lot of the attention to this came around, well, what are we doing in workplaces around sexual harassment? What are we doing in workplaces around partner violence? If we're having gatherings in workplaces, like how should we think about alcohol and sexual assault, et cetera? And that got students in the door to start then thinking about things for themselves. So while I have vamped, folks have shared information, which is great. So Lara said people are rightly hesitant to call for help from campus public safety or police. I think that workshops around thinking about your pods or safety networks and who they can call is good messaging and a good activity. Yeah, Lara. So what Lara's sharing too is that folks can do some more of that. And there are some, I've known some groups that also use online tools for this, of how do you brainstorm those people who can help you and support you, who can be a part of your pod, of your group, that are a part of your circle and feel safe to you, that you kind of self-define to contact and get support from. If you're feeling that systems aren't accessible to you, providing that support, et cetera. And brainstorming those in advance can be really valuable when you get into a situation where you might need to call on those people. And really setting parameters and boundaries up front can be helpful. Rick talks about outreach at tabling events. We provide brochures about our services and share our 24/7 hotline for sexual assault victims, survivors, or concern for friends and family. And getting resources out there into the hands of people is really incredibly valuable, and thinking about virtually how to get things in the hands of people in a way that they'll think it applies to them. I know, for example, I've worked with a lot of campuses who have targeted all of their messaging toward residential students, even campuses that have up to 50% of students who are not on campus. And that residential message makes it feels like these resources aren't for me if I commute. Like I only come to campus for class. Like the interest in the university in me is about classes and the academic side. And so it was really important for commuter students to have information targeted to them that specifically talked about resources on and off campus, specifically talked about them being accessible to students regardless of where they lived, and that really talked about folks with families, folks with jobs off campus, folks with lives off campus, and shared examples and stories and scenarios that related to their lived experiences. I would probably want to put an emphasis that grad students, commuter students are still members of the campus community, and they have the right to contact campus resources and really promote the partnership that Restore, this person's organization, has with campuses. Yeah, sharing that information is incredibly valuable, because I know, and for me, as someone who is both student and faculty at once, I'll read stuff for students and I just assume it's not for students. And I know most people I know who are graduate students similarly read communications. And that sometimes schools that specifically and only work with graduate and professional students might not release information in ways that feel good to people. They're in those long emails. And right now, especially with screen and Zoom fatigue, folks are like, wow, this is a really long email. I'm going to look at the headlines and then move on. What would help look like for you? Self-reflection, kind of name of service that they can provide that exists. Yeah, what would help look like for you is a great question. And sending messages to folks and asking them those questions to get the qualitative data to tailor information, but also with each individual person that folks are working with or encountering, asking those kinds of questions. I also like to remind grad and non-residential students that all campus and community resources are also available to them. Absolutely common thread throughout this. Sometimes it's helpful to frame counseling group crisis resources as an avenue to process experiences and to think about next steps. Yeah, that folks can feel like they're signing up for something, and especially busy people. And I think that graduate students and commuter students, undergraduates aren't busy, but I think that there's a lot of competing priorities that folks are facing who aren't embedded in campus community, and they're like, this is like too much work. You know, this is like another job. This is a lot that I have to think about. And I don't want to sign up for this like long-term counseling relationship or reporting process or whatever anything is. And really being able to talk about advocacy support and process support in a way that's like, this can help you kind of get your bearings, think through options, see if any of them make sense to you. And if they don't, you can not access any of them, but it's more of an entryway. How do you send these messages when schools, Title IX, are not really involving us because they are doing, meeting most of their requirements online? So Monica brings up a great question related to meeting requirements online and partnering with campuses. So, and I think that we're in a situation too where we're dealing with a lot right now related to the new Title IX regulations, and some schools are reading those differently than others, all 2,003 pages of them. And what I think can be really helpful with sending messaging is to think about the fact that on campuses, the Title IX folks are not the only sources of messaging, right? That you have student organizations, student spaces, specific departments, et cetera, with whom you can partner to get that information out to more targeted groups of people. It can be hard, even if you work on a campus, to get information out to people if the campus is prioritizing online modules, or the campus is prioritizing streamlining of messaging. Even if you work there, like even if you're the person who directs sexual assault prevention on a campus, it can be hard. But particularly if you're not on campus, it can be hard. And so doing that more targeted collaboration can be valuable. And as we all have limited bandwidths, can be helpful to think, what am I seeing through data, or what am I seeing through who we're seeing for services or who we're not seeing for services, about who I might want to speak to directly? Because contacting the student affairs person who works in the law school, or even a faculty member who has some aligned interests, can help you to get connected with people in a way that is unfortunately less coordinated, because consistent and coordinated messaging, you know, is the ideal situation, can help you get some of those inroads. And I welcome other folks' thoughts on how to send messages when the campus is really focusing on online modules and not bringing in people from the community. And I would say too that folks who are doing community-based work and not campus-specific work are not embedded in a campus, so you're not, you know, sitting with a .edu email address, you're not funded by the institution, have a lot of opportunity to engage with folks on campuses in ways that get information that's incredibly valuable to what that campus is doing. And that partnership can be really crucial if the campus will allow it. And if the campus won't, through more of the centralized Title IX or prevention wing of the university, there are to really think about other opportunities to engage. Reading and following the campus newspapers can be a helpful way to get a sense of that there are sometimes articles that come out, messaging that comes out from students who are really seeking support and engagement, and they can be really helpful too in helping get information out there to their constituents, sometimes more effective. So briefly want to touch on the idea of difficult questions. And this sort of feeds into the idea too of being in a place to get those difficult questions. And I think a lot of the concern that many of us have is, how do we adapt what we're doing in a universe where a lot of campuses are saying, you know, we're not doing co-curricular education on campus because of physical distancing and minimizing the number of people in our campus. There's a lot of online spaces that are emerging. How do we really create spaces for folks to ask difficult and challenging questions? And before I go into this section, I'll share one way to create those inroads to take advantage of some of the challenges of the situation, is that many faculty who are on campus are trying to shift their courses in ways that are incredibly challenging to do. And we all are, right, around our work. I work with a bystander intervention program. We're trying to figure out what do we do to shift our program. We haven't evaluated online. A lot of people haven't evaluated their work online. We have these kind of self-navigated modules. Then we have these in-person programs. How do we do meaningful prevention work in online spaces, et cetera? But I'll say that a lot of people are looking for content and material and support. And so doing outreach to faculty right now can be really valuable to kind of create some space as an expert to dig into these questions with people, even if those courses are online. I know that for me, as someone who teaches about violence and trauma, that it's really helpful to have folks come in and facilitate conversations that are more so designed to engage my students as human beings. And I certainly do that, but my role is to train them to be professionals and less to ask a lot of questions about their own thoughts on consent, et cetera. And bringing in folks who do that work can be helpful for me to maintain my role as faculty and not to dig too deeply into folks, like folks feel pressured to talk about stuff with their faculty member. But it also provides for a lot of faculty who are scrambling a day where they don't need to worry about lecturing into a webcam. And so it can be helpful to make those connections. So some difficult questions that came up for us, and if you have questions that have come up for you, I'm interested in the chat in you sharing those if you're willing to do so. But 3 questions came up for us as questions that were really challenging. One was, what if both or all parties were drinking? So often followed up with, did they rape each other? So if 2 people are drinking or the number of people involved in a sexual encounter were drinking, didn't everyone just sort of harm each other in that situation? How do we know? The second was, how much alcohol does someone need to drink to be considered incapacitated or unable to give consent? The word incapacitated, we talk about in this toolkit and in our article. I'm just getting to the page 22, came up a lot for us. The idea of like, what does this mean? We see the word incapacitate a lot, like what does it actually mean? Both definitionally, but also what does it mean in practice? Like, what does it mean to be, are you incapacitated or not? I think that folks had a pretty good idea in our research what it meant to be passed out, right? And people had a pretty good idea of what it meant to be sober and not to have anything to drink. But this incapacitated place or being unable to give consent was really confusing even to people who do practitioner-related work, because so many policies say incapacitated, but how do you train people on what that means? And 3, is all sexual contact considered sexual assault if alcohol is involved? So I welcome other questions that you get that are difficult or frustrating or sometimes designed to troll you, because sometimes they are. But these are some questions that came up for us. And what was really valuable to us, and what I encourage you to do too, is to workshop what your answers are, because a lot of the focus, I think, can be on frustration. What we know from a lot of folks we interviewed is people will avoid these questions, or what they'll jump into immediately is answering the question in a way that involves like medical or legal or policy language, when the rest of the workshop like wasn't about that. So, you know, any amount of alcohol inhibits consent, like that's an answer you could give. But what do folks do with that when we know folks are in alcohol-fueled environments, they are drinking, people certainly drink and have sex and don't emerge from it thinking that sexual assault happened? How do we actually answer those questions? Jenny shares, if someone can't remember what happened, how do they know they were sexually assaulted? Another one of those questions. That's a difficult one to answer, but it's also sometimes kind of put out there. And what we found was really helpful, and on page 22 in our toolkit, we have some talking points here, is to really workshop with other people who are not trolling you, people who do similar work to you, convening with partners around what the answers are. And what are the answers that are in line with the values of your prevention work, that are aligned with social justice work around violence, which I think all anti-violence work is. What are your answers so that you can provide them succinctly and clearly to folks, because they do want answers. Sometimes these questions are really asked to derail, and sometimes they're asked because folks don't know, right? Especially this second question, but all of them, depending on, you know, the tone of voice that someone is using and what they're saying. But these questions are often asked because folks don't know, and we want to really think through our answers. And I already asked this, I jumped the gun here. So one of the examples that I'll share quickly about this is around consistent messaging in multiple contexts. So sometimes folks, and this has been shared, Monica mentioned this in their question, but consistent messaging in multiple contexts, like folks are getting one message in one place that says, you know, any amount of alcohol means that people can't consent. Then they're getting information somewhere else that says, well, it's this much that leads to incapacitation. Here are the signs of incapacitation. They're in another setting that says, well, things are pretty much fine until somebody is passed out. Folks are getting messages from all sorts of places, student leaders, pre-matriculation information on the subway, information on the bus, and inventorying those messages can be really helpful to see what students are getting, including from media, about multiple contexts. So I think, for example, about the duality that exists right now, and that folks are talking a lot about rise in intimate partner violence, rise in drinking, rise in sexual violence, including associated with high-risk drinking. And there's also this incredible proliferation of memes about folks killing their partners or kids because they're stuck inside with them, right? And that proliferation of memes and statements, et cetera, that kind of minimize and talk about really serious issues, because we are seeing increases in intimate partner homicide, we are seeing increases in intimate partner and sexual violence, we are seeing increases in drinking. That what does that messaging look like? And really brainstorming and inventorying that so your messaging can be responsive to it and not play directly into it. Rick is sharing, I had a call when a person asked this question. At the time I said, if you believe you have the option to report to the police, I had no other answer. Yeah, I think that what's hard here, if someone doesn't remember that what happened, how do they know that they were sexually assaulted, is that memory isn't the only piece of sexual violence, right? That there are a lot of people who experience sexual violence who don't remember, can't remember, remember later, remember parts of it. And providing education on that and learning more about that can be really valuable in having those conversations. And I think the other thing that's really important is absolutisms are typically really dangerous for work around intimate relationships and sexual violence and interpersonal relationships. That saying, you know, this specific situation is always means this, people involved. The answer I would give is really different. And thinking about the person who is asking that as the person who doesn't remember, or as a person who feels that someone thought that they sexually assaulted them but didn't remember, but they don't think that they did, but they don't remember it, that we really need to think critically about trauma-informed responses that consider all those people. Because when we're providing education, all those people could be in the room. A person who experienced harm in that way could be in that room. A person who caused, or someone said that they caused harm in that way, and a bunch of people who've been bystanders are all there. We need to really think critically and consistently about our messaging, but not necessarily about how we deliver it. That might shift, for example. So I think about in this response too, about what does it look like to think about referring people to support and resources versus what it looks like to refer people when it comes to reporting. Because with the question that Jenny shared, for example, it's possible that someone would have a more challenging time going through a reporting process if they don't remember. Saying that that person can't get help, support, connect with people, or have any options available to them at all, should not be dictated by their memory or not, right? But there might be some things that are impacted by someone not remembering things. And it can be helpful to first, as others have mentioned, steering that person to advocacy and support and a place to really talk and figure these things out before they're thrown into a situation where their authenticity is questioned. And I'll just share briefly that there are also, in the interest of time, because I want to respect your time, Some of these difficult questions also change form depending on who we're talking about. So I've been on various campuses and consulted with campuses where there's a lot of discussion around these difficult questions and international students related to quote unquote cultural differences, or related to particular groups having quote unquote problems with X times of violence or the other. So as an example, what emerged in the research that I did was a participant had been asked to go and speak to international students because the previous year they had seen an increase in reporting in a particular group of an international student group from a particular country. So they had X number of students from X country come forward for support. And this prevention educator was really kind of agitated about this because they're like, this group has a problem. Like the country, students from X country have a problem. And she's like digging into this a little deeper. And what she found out was that a lot of these students came forward because they had done really important targeted outreach with international students, particularly students who had come to the university from that particular country. And it wasn't a matter of, oh, there's been all this violence. It was a matter of, we had 3 people come forward because they had attended these series of workshops and conversations specifically for that group. So I think it's important to remember when we're thinking about these difficult questions that yes, we want to tailor them to the needs of particular groups, particular students, particular cultural contexts, alongside folks who actually have those lived experiences and have those contexts. If we don't have them, we can't tailor them. But also to be really mindful and intentional around extrapolating something to a whole group and knowing that context. It was really important for that prevention educator to know, one, that key staff thought that students from X country had a particular problem because they needed to address that xenophobia. They needed to address why that perception was happening and what all these dynamics with that staff person. But they also needed to know that in speaking to the students, because those students had gotten this great message about them coming forward and support, but maybe also needed some messaging around bystander intervention and helping friends and thinking through cultural implications of those things. Difficult questions also in our research came up around thinking about sororities and fraternities and thinking about space and the space that folks convene and the social power that people have, is that these questions seemed to shift for folks when they were in Greek party environments. And so, well, if you go to a party, you should know what's going to happen, or this is just what happens at parties and those kinds of things. And so what was really valuable for prevention educators we talked to who saw success in addressing these questions in their workshops, this is true for any group, but I'll highlight fraternities and sororities, that they met with a lot of fraternity and sorority members about how to debunk all these myths that come into sororities and fraternities, that there are often people in any group who want to end violence, want to prevent violence, don't think violence is acceptable. And working with those folks around, well, what comes up when we talk about this? What do you hear? How would you debunk this? The idea, for example, that, well, sororities and fraternities keep things private and look out for themselves. Another piece of sororities and fraternities that prevention educator had come up were, people look out for each other. People are loyal to each other. People don't want other people in their group to get hurt. And so that you can leverage those norms and counteract some of those pieces that are a little bit, rely on really harmful myths around spaces and groups. So I will transition briefly and turn over to my colleagues, watch my time, at Ms. Casa to share some New York specific information. But I would just encourage folks for some next steps to think about your vision as you think about the upcoming semester, your work that's coming up in the future, which I know is one happening in uncertain and challenging times in higher education. But to think about your vision for addressing alcohol's role in sexual assault, and to think about your campus partners and your community partners and your student partners and student group partners, and do some brainstorming around even what 1 or 2 of those partners would look like, and talk to them about their vision and your vision around addressing this intersection, and doing some brainstorming around scenarios or pathways to messaging or answers to these difficult questions alongside them to get some more ideas on how to move forward. And with that, I'll turn it over to my colleagues. And I think I need to click for you, so let me know when I should do that.
Yes, I will. So In New York State, any and every individual who feels that they may have been a victim of drug-facilitated sexual assault has the right to request a DFSA kit in conjunction with their sexual assault forensic exam. Obviously, this is best for those who report right away and who seek medical attention as soon as possible, seeing as most drugs often leave the body within 96 hours, so obviously the sooner the better. So this may not be feasible for students who have chosen to report at a later date or who aren't sure, so they don't want to complete a DFSA. Under Enough is Enough legislation, institutions must be the ones who create the environment that allows students to feel comfortable describing the circumstances that led them to believe they've been a victim of DFSA. And that institution should be the ones providing information about doing a safe exam. And if that individual chooses to do so, the institution must be the ones providing them with accurate resources and access to them. But I will talk about that later on when we get to the Student Bill of Rights. But along with that, the payment for processing of the DFSA kit varies by county within each state. So it differs depending on what university you're typically serving. You can go to the next one. So as defined by the Ed Law in section 6441, affirmative consent is defined as a knowing, involuntary, and mutual decision among all participants to engage in sexual activity. Consent can be given by words or actions as long as the actions are clear. Permission regarding willingness to engage in sexual activity. Silence or lack of resistance in and of itself does not demonstrate consent. Consent's needed regardless of whether the person is under the influence of drugs and alcohol. Consent can be initially given but withdrawn at any time. Consent cannot be given when a person is incapacitated. Obviously, the issue with that is that depending on the degree of intoxication, incapacitated may be different for each individual person. So like we mentioned before, it's hard to just establish what incapacitated looks like. And when consent is withdrawn or can no longer be given, sexual activity has to stop. So within the Student Bill of Rights, students need to be treated with dignity and receive adequate services from the institution and be free from the suggestion that the reporting individual is at fault or should have acted differently to avoid the sexual violence. So in relation to affirmative consent, the institution are the ones responsible for creating that environment, for allowing the students to come into a space that allows them to report without feeling embarrassed about the circumstances of this assault. And I think this is especially important in relation to alcohol and other drugs because both the reporting individual and the investigating party may have biases about sexual violence involving alcohol and other drugs, which goes into the amnesty policy that we'll talk about next. So, LB, yeah, there you go. So under the policy for alcohol and other drug amnesty, the law states that institutions are not able to address internal violations that may have occurred at the time of the incident by either the bystander or the reporting individual. This, however, does not include the respondent who is being suspected of drug dealing or using the drug as a weapon. So in a little bit of further explanation, a reporting individual who may have been using alcohol would not be in trouble for using said alcohol, but the person who is using that alcohol as a weapon or taking advantage of that alcohol use or other drug, if another drug is applied, would be able to be brought up on conduct charges based off of that. This is included to obviously encourage victims to report without the fear that they'll be retroactively punished by the institution, and to just get them the best services that they can have. And in accordance with the Student Bill of Rights and Subdivision 6, it basically says that institutions and those working with the reporting individuals have to use a widely adopted trauma-informed approach when asking these questions, especially involving incidents with alcohol and other drugs, and in no way should it be suggested that individuals are at fault for a crime that's committed using alcohol or other drugs or in attendance of an event where alcohol or other drugs are present. Are there any questions about any of the New York State specific stuff. Awesome. Well, it's nice that now EIE is a lot stronger than the current Title IX standings on stuff like that. So that was just my little plug for EIE.
I just want to thank folks for coming. If there are further questions that folks have and want to share in the chat or otherwise, you're welcome to do so. If you're looking for me, you can find me at lbklein@unc.edu, and I'd be happy to share any research or resources that we've come across in this process, or direct you to locations where folks might be having conversations you'd be of interest in these issues. And I'm just grateful for everybody for being here and participating today, and for being a part of this really important work. I know that there's a lot that is shifting in higher education, and that everyone is trying to figure out how to navigate those changes. And I'm grateful that all of you are doing that important work.
Yes, thank you all for tuning into our webinar. I really appreciate you all joining. And if you need any assistance or need any information, feel free to reach out to me, or if you're in downstate, you can reach out to Nastia. You can go to the next slide, Albie, if you can. That's our information. Please feel free to reach out if you need anything. Thank you for taking time out of your day to join us. All right. Thanks, everyone. Have a great day.